Hello, my name is Dr. Ben Thompson, founder of Treble Health. This video is focused on the fight, flight, or freeze response and how that impacts tinnitus. If you have ringing in the ears and you're looking for ways to reduce it, this may be one of the most important videos you could watch. After I've been working with tinnitus patients for years in the in-person and telehealth model, I've seen the impact of reducing the psychological response of tinnitus and how that changes the treatment outcome. When you think of tinnitus, you're probably aware that the psychological, mental, and emotional piece of living with the condition, managing the condition day in and day out, that is some of the challenge. That is some of the most difficult piece of this. And after guiding people through this process for years, what I've seen is the limbic system, that emotional center of your brain, that has pathways, it has channels that connect the tinnitus source in the auditory brain. Those cells that are activated, hyperactive, when the emotional brain is connected to them, it's wiring the neurons, it's strengthening the cords. What we need to do is figure out how to rewire, how to reduce or de-strengthen those connections. And when that happens, your tinnitus perception improves. I've seen this over and over, whether it's working with a therapist, working with an audiologist on the stress, anxiety component of this, whether it's learning about the facts about tinnitus, whether that's stop going online and trying to find all these answers and do all this research. It can increase the anxiety and the stress response of the limbic system. All those components play a huge part. And I'm telling you in this video how this will work to explain the fight, flight, or freeze response and show you how I think understanding this can change the outcome of your tinnitus, and it can honestly change the course of your life. So how does the stress response impact tinnitus and what can be done about it? First, we need to explain what is called the neurophysiological model of tinnitus. It is based on this that you can habituate and reduce the perception of the sound of the ringing in your ears. Breathe in and out through your nose right now. You may have heard a sound, and in fact, when I breathe at a normal rate, I always hear a sound, but only when I'm listening for it. That's an extreme example of the brain's ability to habituate or reduce unimportant sounds in the environment or related to my body. In all intensive purposes, tinnitus, ringing in the ears, is a benign body sensation, just like the benign body sensation of the sound of breathing. The sound of tinnitus by itself does not equal a threat, a danger, something that's going to hurt us or damage our safety, but the brain is reacting to it as if it is. And that's not at a top part of the brain conscious state. It's a deeper part of the brain, the same part of the brain that makes all of these decisions for us at a subconscious level. That's what's driving this habituation response. That's what's driving this limbic system response. I'm going to show on the screen right now some images of the hearing system where we have the outer ear, the ear canal, the eardrum, the hearing organ, and then the hearing nerve. For 99% of you, your hearing did not change at the time that your tinnitus became bothersome. However, the cells in the ear are responsible for the chain of events that can lead to tinnitus. The eardrum is usually healthy for those who develop sudden tinnitus. There's usually no earwax in the ear canal. The cochlea, the hearing organ, may or may not have a hearing loss. If we study closely the cells in the cochlea, those cells are not performing the way they used to. So that difference of those little cells, those microscopic stereocilia in the ear, the difference of how they're working now compared to in years prior, that can create the potential for this phantom sound response in the brain. On the screen now, you'll see images of those little hair cells at a microscopic level. If those are damaged through the natural aging process, through a hearing loss, or through some loud noise event, that can create this phantom sound of tinnitus. I, for example, have a mild case of tinnitus, and I've had it for about 9 years. When it first started, I noticed the ringing sound in my head when I was in a very quiet place. And eventually that started to become more noticeable. When I was in quiet places, when there was no external sound, I was hearing the ringing in my head. Personally, that came about after going to many live music concerts without earplugs and hearing protection. Well, I'd tested my hearing and my hearing was in the normal range. So I'm someone who has hearing overall healthy, but I know my hearing, those cells in the ear, they're not what they used to be. And that difference is enough for my brain to perceive this phantom sound of tinnitus. The limbic system is the area in the brain where we translate and process how things emotionally are affecting us. The limbic system takes all the sensory information that's coming in, vision, hearing, taste, smell, touch, and it processes those signals to tell us in our conscious waking state, what should I be focused on? What should I pay attention to? If something is affecting us either positively, very positively, emotionally, or negative, very negatively emotionally, then my brain will think about it. I'll be thinking about that, focused on it. The sound of my breathing is a neutral response. The feeling of clothes on my skin is a neutral somatosensory input. The visual field in my home is a neutral input. My brain knows that's the average, that's the norm. There's nothing new, there's nothing to latch onto there. There's no threat that's going to affect my ability to stay alive. So now we're getting into this important piece here, that the limbic system and the lower parts of the brain come from our evolution of a reptilian brain. It comes from an evolution of these lower brain systems that their main purpose was to keep us alive. If there's a potential threat or danger, like a loud blaring sound or the sound of a predator snapping a twig in the distance, my brain has been primed over time to pay extra attention to that. Because if I do, then I'm going to keep myself alive. And that's all that the limbic system, the brain, wants in terms of a macro goal. All that to say, if we can understand the limbic system and how it's reacting to tinnitus, and if we can turn that upside down and improve that system, then it's going to open doors for getting better with this sound. No matter how long you've had the ringing in the ears, days, weeks, months, or years, understanding the limbic system connection is really important. That's why working with a well-trained audiologist, that's why working with a therapist to help with stress or anxiety, that's why doing meditation to improve stress or anxiety on your own, that's why getting good sleep and focusing on healthy sleep, all of that has a positive response to the stress and a positive response to the anxiety so that it can calm and settle the mind, calm and settle the body, showing the brain and body, hey, this signal of tinnitus, this constant sound, I'm not actually threatened by it. It's not actually going to hurt me. And the fact is, it is a benign body sensation, not a harmful, life-threatening condition. It is a symptom of something. We have to remember that. Well, we can reduce and improve this system when we get closer to the cause. And in this sense, the limbic system being hyperactivated is very close to the cause. So while I mentioned earlier that damage or changes in the auditory system, like the hearing organ, the cochlea, can be responsible for generating the tinnitus signal, it's the limbic system that will drive the tinnitus response. So if I'm very stressed, that affects my limbic system and my tinnitus will spike. If I'm feeling very at peace, very calm, relaxed, my tinnitus is often lower. That is the most common driver of tinnitus spikes, ups and downs, is that limbic system activity. Some of it can be affecting us without you knowing it. Think about being dehydrated. Until you think about, oh wow, I didn't drink water today, I must be dehydrated. Your body knew and your subconscious brain knew, and it was reacting and responding automatically based on its current physiological state. So whether you know or not that you're dehydrated, your body and your brain is reacting and responding as if it already knows because it is living in that constant state. Well, with tinnitus and the limbic system, you may not be aware that your brain is reacting and your limbic system is reacting to tinnitus, but it is happening already and it's affecting us. Things you can do to help your limbic system are often focused on reducing anxiety related to the condition, reducing fear related to the condition, reducing stress in your life, improving sleep, and having a clear guide and a clear path on how you can manage and how you can recover and get better with tinnitus. When you have that all in place, the limbic system is kept in check and your mind is settled. Understanding that your tinnitus is not only an auditory condition and there is a big involvement with the emotional brain is huge. And it illustrates the fact that when we are treating patients, when we are helping patients in our telehealth model at Treble Health, for example, when we're focused on improving your condition, it's absolutely critical to consider all of the factors that are related to tinnitus, not just the sound, not just the hearing, not just the sound therapy. So first, we want and we need a hearing test that can show us, is there a hearing loss or not? If there is a hearing loss, then treating or aiding that hearing loss with hearing aids that are programmed very specifically for tinnitus, it's something we've seen a lot of success with in our telehealth model. Additionally, if your hearing comes in the normal range, like mine, and you're going through a very intense tinnitus spike, then having tinnitus maskers programmed on your ears that you can use during this habituation period, we also see a high degree of success with that. So that's the first piece of this. What is your hearing? Let's make sure we're giving you all that we can, because that's sound therapy, the white noise, the pink noise, consistently used over a period of months, sometimes longer, that helps the brain habituate. That works with the limbic system to show the brain, hey, this signal is under more control. Hey, this signal is not actually a threat. Hey, I'm thinking about this signal less. I'm less bothered by it. I can concentrate better during my day. All of those inputs help the limbic system keep the tinnitus in check. The second piece of this that is critical to understand when working with the emotional brain and the tinnitus and the limbic system is that extreme distress can be a result of developing louder tinnitus. Going through periods of high anxiety, depression, insomnia, panic attacks, breaking down, crying, all of this are things that our patients go through, that they reach out to us and they explain, I found you guys because I was going through this. So I personally have empathy and an understanding of what that is like. However, remember this, that extreme distress is a result of a heightened limbic system. So let's do what we can to process the distress, process the high degree of anxiety or stress in a safe, constructive way so we can settle the limbic system and bring it back down to where it was. For those who are going through severe levels of distress, an audiologist on our team may need to refer you to our telehealth partners for therapy, mental health therapy, psychiatry. It may be appropriate to consider medication given the degree of distress. We can certainly connect you to the right professional and have the right referrals in place to make sure we're doing everything we can quickly to keep the limbic system in check to help you on your habituation. The third consideration here is that sometimes tinnitus comes first and the anxiety and stress comes second. Other times anxiety and stress was already there and tinnitus comes as a result of it. Either way, there's no doubt that having sudden, louder, bothersome tinnitus that affects you for most of the day will create a high degree of stress and anxiety. That's expected. And what is happening behind the scenes, that's your limbic system activated. When we say fight, flight, or freeze, that's coming from the parts of our early brain that, again, we're trying to keep us alive based on the intensity of signals and the intensity of stress. So if you were under attack or if you were under stress and under a potential threat or danger, then your brain has been designed to either fight and stay alive by fighting and attacking, freeze so that no one sees you so you can stay alive, or flight, run away so you can stay alive. Think about those states of mind, those states of being. Your body gets tense. When you walk on a trail and something moves in the bushes, you immediately jump and get your body tight and wound up. That's not a conscious choice. That's the same mechanism here. A sound triggered this reaction, the fight or flight or freeze response, and then your body's going through this process of trying to immediately make a decision. Am I fighting it? Am I running away? Or am I freezing and staying still? The same thing happens with tinnitus. And this means that one can lose their appetite because their body's in this heightened state. You're not breathing deeply into your stomach because you're in this fight or flight response. You feel anxiety, you feel stress, it's hard to concentrate. All of those are symptoms and clinical manifestations of the activated limbic system and how it affects the central nervous system of the body. There's two parts to the nervous system. One is called the parasympathetic state, and the other is called the sympathetic state. In this fight or flight response, activated, stressed, alert, that's considered the fight or flight sympathetic state. In states of deep calm, in states of deep peace, that is considered the parasympathetic state. It's possible to access the parasympathetic state by doing certain practices like guided breathing, meditation, guided body scan, taking walks, etc. If your limbic system is acting up right now, let us know in the comments below. We're here to support you. It's important to remember that specifically targeting the limbic system is key. In my opinion, the best way to do this quickly is to have one-on-one counseling, one-on-one therapy with someone who is well-trained and has personal experiences with tinnitus. Our audiologists fall into that camp. What we've seen is that the one-on-one model, whether it's meeting weekly, bi-weekly, monthly, is effective in getting out of these negative thinking loops and this tinnitus trap of stress. The sound gets louder. I have anxiety because I don't know what's going to happen in my future because of the sound. I start to get more stress. I start to lose sleep. I'm having insomnia. The tinnitus gets louder because my body's not feeling great. I have more anxiety, negative thinking. Those are loops that can just spin out of control, spiral out of control. Your job is to learn how to develop an awareness of them so you can stop and have tools and techniques to get yourself down to your baseline and calm the mind. One-on-one counseling, one-on-one therapy is an amazing way to do that. Your job and our job helping you as professionals is to condition the brain to change the way it categorizes the tinnitus. So when you can work to eliminate the stress response over time, then the debilitating effects of tinnitus subside and habituation begins to occur. Some patients have extreme involvement of the limbic system, and when that happens, medication or higher forms of intensive counseling like psychiatry or psychology intervention is helpful. All of those are used in unison with the tinnitus masking, with the sound therapy that's being played through the ears. That's the best approach to this, is to take a comprehensive view of the limbic system activity and the sound therapy using sound devices in our audiology approach, plus having the psychological limbic system reduction either by an audiologist or a well-trained psychologist or therapist. That is the approach that works for a vast majority of people. Do not lose that truth and be patient, because this might not get better immediately. It typically takes weeks or months to notice some traction and to feel like things are really changing in terms of how the sound is affecting you. The Tinnitus Impact Quiz is an effective tool for you to gauge where you are in terms of the severity of your tinnitus and the severity of how it's impacting your limbic system. We'll include a link below for the Tinnitus Impact Quiz, which is a quick 5-minute check that we created at Treble Health. You can find that in the description of this video below. In our experience, tinnitus therapy with a well-trained audiologist from Treble Health in the telehealth online video consultation modality has been an effective treatment and an effective therapy for tinnitus. When you also include the tinnitus maskers and the sound therapy or the hearing aids into that, then it really gets people through the hardest parts of tinnitus and it allows them to habituate. Once you're habituated, you don't need one-on-one counseling and you don't need individualized tinnitus masking set up for your ears. You can phase those out over time. My name is Dr. Ben Thompson. I am the founder of TrebleHealth.com. We have an online telehealth service for individuals with tinnitus. We're very passionate, very engaged in this community. Please subscribe to my YouTube channel here to watch more videos. And it's important to remember to never underestimate the role of the stress response with tinnitus. It's important to remember that you as an individual can have tools you can find a toolkit, you can find a guide and a group of professionals that will help you through this tough period. When you can target and eliminate the limbic system's involvement in your tinnitus, then your treatment can be truly effective. Thank you so much for watching this video. On the side, you will see another video that is linked to our approach to tinnitus care and how we at Treble Health are helping individuals get through this process. I really appreciate you being here, and I wish you well on this tinnitus journey. Thank you.